general population, said to be commoner among women. Yeah, but of course, it also can vary depending on your age. Tends to be more in the elderly. Next, please. The common complaint when people have difficulty with sleep is usually with I spend a lot of time before I then fall asleep, and that's to do with the sleep initiation. And then some people are able to fall asleep but wake up frequently during the night. That has to do with maintenance of sleep, whereas some do wake up very early in the morning. And some people they're able to sleep through the night, but they report not having refreshed sleep when they wake up in the morning. So that has to do with the quality. So we'll go through all this shortly. Um, and like I said earlier, there are daytime consequences to these things. What happens when we don't sleep properly at night? We are fatigued in the morning. We are more likely to be irritable, and our memory is usually not great. And of course, that can affect our outputs at work, um, and of course, generally our quality of life. If you if you drive, you're more at risk of motor vehicle accidents, and if you undo certain machineries, there could be accident at work. So these are some of the consequences, apart from the fact that it could also aggravate psychiatric disorders or physical health disorders like um, cardiovascular problems. And in terms of what are the categories of insomnia, because we recognize that some people do have period where they are unable to sleep, and then subsequently that changes. So there is what we call the chronic insomnia, and then the short-term insomnia, and then other insomnia disorders. We will see this in more detail in the next slide. Um, so yeah, go on to the next one, please. Yeah, so I'm starting with the chronic insomnia disorder. This is looking at people who have had difficulties with their sleep for at least 3 months. And that's what separated from the short-term insomnia, where the duration is less than 3 months. The other criteria or the other findings are the same, apart from the duration. So, like I said earlier, they could have problem with the initiation, maintaining, or waking earlier than desired. That's one of the commonest problems. I mean, the problem with sleep itself, the quantity, and then apart from the quantity being reduced, there is resultant daytime problems, some of which we just discussed. And then this is despite having had adequate opportunity to sleep. So you cannot say you have insomnia when you are not um, having, you're not presenting yourself with the opportunity to sleep. Maybe you're writing exams, you're depriving yourself of sleep, or you don't have a comfortable place to sleep and all that. So those are not what we consider under the umbrella of insomnia. So you must have adequate opportunity and circumstances, and this difficulty must happen at least 3 times in every week. So the difficulty, whether with initiation of sleep or maintenance of sleep and waking up earlier than desired. Now, for example, I mean, someone goes to bed. Um, how long does it take for you to now say you have a problem with sleep? Anything beyond 20 minutes of being in bed for children and young adults is considered to be delayed sleep onset. But for elderly, above 30 minutes is allowed. Um, Anytime beyond that, it's can be said to be problem with initiation of sleep. Also, when you wake up in the night, during the night, and you're unable to go back to sleep after like 20 minutes or 30 minutes, depending on your age, then you could um, be said to be have a problem. And that has to happen at least 3 times um, in a week before it can fall into that category. Yeah, so we've talked about the chronic insomnia disorder and then the short-term insomnia disorder. I mentioned that the only difference is actually the time duration, which has to be less than 3 months for short term and more than 3 months for the chronic insomnia. Um, yeah, this 3P will be relevant in when we are doing our assessment as a clinician. Um, but we could then go to the next slide, which talks about when you're being you have the opportunity of meeting with your clinician. The clinician is looking at um, taking history of your sleep problem, conducting thorough examination, and then having some investigation before then establishing a diagnosis. Um, Next, yeah. So, what are we interested in as clinician when we're looking at the problem with sleep? We want to know that when did it start, and that tells us whether it's as a result of something else that was going on for you, and then sleep problem is complicating that, or primarily it's the sleep problem that is now causing other issues that you're having. So that is very important. So when we um, want to do a full assessment of people with sleep problem, we are not only interested in what happened at night. We start by what are the activities you do during your day, starting from the morning till evening until the bedtime. So, and then we look at what aspect of sleep difficulty do you have. Like I said earlier, is it with the initiation or maintenance or early morning awakening? And then is it a consistent thing or just um, something that happens occasionally? And then we also look at your habits in terms of um, a lot of habits are counterproductive towards sleep. Use of alcohol, especially towards bedtime, um, caffeinated drinks towards bedtime, exercise, which is very good, but it should be at the right time. So these are some of the things that we are interested in. And we also need to know what are your physical health issues. Have you had any problems even before you started having the sleep difficulty? And do you have a regular pattern in terms of your sleep? And what then we go to what happened at night, which entails are you waking up frequently? Do you have a conducive environment? Is the environment your bed not comfortable, or did you sleep in a noisy environment? And all that will give us a good picture of what is really going on. Next, please. Yeah, I think I mentioned this before. So that's talked about for how long in you have to be in bed before, I mean, for the duration of your delay in going getting sleep, for you to say, okay, I'm having difficulty with sleep. Most people, when they get to bed, they're able to sleep immediately, but some can maybe 5 minutes, or then when it starts getting problematic is when it's more than 20 minutes, like I said earlier, and 30 minutes for more elderly people. Next, please. Yeah, so in terms of examination, we do physical examination because um, there are a lot of physical health conditions that could lead to problem with sleep. For example, if you have problem with the the gland in the neck called the thyroid gland, and it's functioning in an unusual manner that could cause some problem with sleep. So while we are examining you, we're looking at all that to see, can that be a problem? We also look at sometimes look at the back of the throat to see if you have what can suggest sleep apnea, which is another condition that can keep people awake, especially with problem with waking up frequently during the night. And of course, we always do mental state examination because a lot of psychiatric conditions are associated with a problem with sleep. Um, Depression is one. Um, Most people, when they are depressed, sleep less and we tend to wake up earlier than usual, as well as people who like opposite of depression, they're manic, and they don't even feel the need to sleep at all. There are other anxiety disorders that could make sleep difficult at night. A lot of people who have insomnia worry a lot, and that tends to also, um, especially so at night, and that affects their sleep. So we do both the physical examination and mental, I mean, the mental state examination to be able to arrive at what possibly might be the cause of the difficulty with sleep after taking adequate history. Next, please. Yeah, so for insomnia, where of course, like you might um, guess, that we do not necessarily have to do a blood test for us to make a diagnosis of insomnia. However, we could use some questionnaires, and we use what we call the sleep diary, which is asking the you or whoever is having that difficulty to keep a record of their sleep over at least a 2 weeks period rather. And 2 weeks, that 2 weeks period gives us a good information about how regular, in terms of your time in bed, when you go to bed and when you are out of bed. And we also, I mean, there are a lot of smart watches that people do use now, and that could also be, even though they are not 100% accurate, but of course, they could give us some information. We could also administer other questionnaires to see if there are other good things going on, like other mental health problems. We do sometimes need to do some tests, like a blood test to do thyroid function test and all that. Yeah. So these are some of the things we do in terms of investigation. Yeah, I think I've spoken about the fact that there are a lot of other conditions that could affect our sleep that we must then check while we are doing our assessment. Then I guess what is most important to people is how do we treat insomnia, especially once we've made a diagnosis. Um, Next slide. We do the initial assessment, establish the diagnosis, and then we have goals, which is looking at improving the quantity and the quality of our sleep, and reducing or eliminating daytime impairment. That is the difficulties that arises from the insomnia. And then we decide how to go about it. So if you go to the next slide, we'll talk about the approaches, which includes use of medications and other approaches that do not involve medications. Now, medications, I'm not going to dwell on that because that will need to be guided by doctors in terms of medication. A lot of people do abuse the medication, but it's important to say that long-term use can be counterproductive. but sometimes we do have to use long-term prescribing, but we will have to engage with our doctors to decide on that. Now, non-pharmacological approaches, we are familiar, a lot of us are familiar with what we call sleep hygiene, and we can always get that information online anyway. But the mainstay of treatment is actually what we call the cognitive behavioral therapy for insomnia. That is the treatment of choice for established case of insomnia. And it is advisable that before going on medication, the CBTI should be the first line of treatment. Otherwise, it becomes more problematic to treat insomnia once people start using a lot of medications. Now, I might have to take more time later to talk more in detail about the CBTI for insomnia while I take a pause to start to kickstart the other session. I know there'll be a lot of questions around CBTI for insomnia, and I'm happy to um, provide more information about around this.
Thank you. Thank you so much for that session, Dr. Adeoye, and thank you for being so timely. I just want to tell everybody that Dr. Adeoye had lots of slides loaded for us, and I'm sure that it can be made available via our emails if we really want to know all of those details. But I know that a lot of people on this call today, what's really on their hearts is how can I sleep better tonight? Am I echoing anybody's thoughts or ideas? Yes, I'm sure I am. So, how can we sleep better tonight? That's what we've promised, and that's what we'll be delivering, hopefully. Yes, I can see some thumbs up. So, we're going to be having a fire chat side session with Dr. Adeoye. Myself and co-founder Bisola would be having this session. We got lots of questions coming. Oh, what am I going to do about sleep? What this, sleep that? Okay, so we're happy to dive into those questions and we'll be able to contribute. Hope if you have any other questions, please just put them in the chat box. I will be monitoring the chat box. So over to you, Adebusola. Let's start with the question session. You're muted.
Thank you, Omotsi and Dr. Adeoye. Thank you, Dr. Adeoye, for giving us that amazing background on sleep. We had a lot of questions, like you've rightly said, given that you are an expert in this, from, seeing client day to day struggling with sleep. And the number one question is really, why don't I fall asleep easily? And also, why can't I sleep for long? That's the majority of the questions that we got. A lot of people wanted to know the reason why they struggle with initiating sleep, like you rightly said during your presentation. Do you want to add a little bit more about that?
Well, I mean, I think I'll start with the second question, which why don't I sleep much? Much is relative. People's need for sleep differs. So you have to know yourself. So how to know what is adequate for you is the amount of sleep that you have in the night that's able to make you function optimally during the daytime is actually adequate for you. But generally, it's said to be that we need about 7 to 8 hours of sleep at night, depending on your source. That's the commonest average. Not everybody will get that long, but of course, some people do get even more than that, or they require more than that. So that's just to establish that that the duration is relative. Now, why do I take long to sleep? That's it. I mean, it has to be individualized because there are different reasons why people take long to sleep. But generally, I think the easiest thing to do is to look at your behavior. What do you do during the daytime? Do you have a routine bedtime? And then what are these activities you do towards bedtime? I guess one of the reason Omoti was, I mean, advising that we probably not stay in our room for this exercise is to train our body to use the room, especially the bed, not just about the room, but especially the bed for sleep, um, rather than turning the bed to an office, because a lot of people do a lot of work, the laptop and all that devices in bed. So the question is, why am I not sleeping? The answer is not straightforward. It has to be individualized and see what is going on for you, and that can guide us to answer that question.
Yes. Thank you. Thank you very much for answering that question, Dr. Adeoye. And I guess that for some people, just a very small percentage of people, they'll probably need a thorough assessment like you showed us to find out what the cause of the insomnia is. So it's not something that we might be able to answer that, oh, this is the reason, but they're just common reasons that we all know. And thank you for doing justice to the question. The next question here is, what causes intermittent waking up, especially in the midnight?
Yeah, yeah. So there are, again, a lot of things that could cause that, but we always look at things systematically. Your physical health and your mental health issues can cause that. But apart from that, the basic thing is where you're sleeping. Is it comfortable? Are you using the correct pillow, the mattress? Is the temperature in your room okay for you? Those are the things I mean, some people feel more comfortable going to bed in their pajamas, whereas some don't. They don't like wearing anything. So you have to discover what's best for you, because that could also make you wake up during the night. Now, your daytime habit, like drinking a lot of water, drinking alcohol, especially within few hours to sleep, to bedtime rather, can also make you need to go to the toilet to use the bathroom. So that could also account for that. But apart from that, there are common things like sleep apnea, which is a condition where breathing it's not um, stops intermittently during sleep, because our muscles are relaxed, and then um, the brain has to wake us up to continue to breathe. So a lot of us are not aware of this, but it happens. So you do wake up intermittently. But of people who are at risk of disease, people who are obese or overweight, and then people with certain problem around their neck, their airway. So if you notice that you snore excessively loudly, you should ask someone to probably look at your sleep at night to observe whether there are periods where it's appear your breathing is stopping, and then probably meet with your doctor. Yeah, so diabetes is another thing where people do need to um, wake up to use the bathroom. And of course, some people do have pain that also wakes them up. So, yeah, a lot of things that could cause this again.
Mm.
Yeah. Amazing. Thank you for sharing that. And it just really makes a lot of sense because, for some group of people, we can really identify that, the physical health or the mental health could be contributing to the sleep difficulties. And even from training from many years ago, we've known that insomnia is a symptom of something. But I want to defer to your expert knowledge now, Dr. Deere, because we are beginning to see people having insomnia as a primary problem without any physical health difficulties or even mental health difficulties, and they're presenting with insomnia. And there are also some people with mental health difficulties and they're having insomnia at the same time. And we've seen that if we address the insomnia and they are able to treat the insomnia primarily with CBTI, we begin to see improvement in the mental health difficulties that they are having. While, the training, while we were in training was that, treat the primary condition, the insomnia will go away. Now we are saying that even when we see the insomnia, when we treat the primary condition, once the insomnia is chronic, we may have to treat the insomnia on its own. What are your thoughts?
Yeah, you're right. It used to be that it was assumed that insomnia is always secondary to another condition, but it's now um, it's now established that it's actually a primary disorder on its own. That even after treating what you believe was the original trigger, the insomnia can persist if it is not well attended to. And of course, um, treating the insomnia in itself can result in a lot of improvement in so many aspects of yeah, our health. Yeah, yeah, I agree with that's
Yeah.
the current trend anyway. Yeah.
Okay. Thank you so much, sir. And thank you, Bisola, for helping us to clarify that insomnia can be a primary diagnosis indeed. Now, I think that it's time for us to, some of the questions that we got are about strategies. So people want to know what strategies they can have when it comes to having a better sleep, because I can imagine that a lot of people here tonight are thinking, oh, if I could just get 8 solid hours of sleep, my life problems would be solved, or I would be a better mom, I would be a better dad, I would be a better worker. So, what strategies would you advise? I know you've said a lot in terms of the sleep hygiene, and but if you were to summarize it, just to bring it in a summary, what strategies can people on here tonight take home and utilize tonight to have better sleep?
Yeah. So yeah, I'm smiling because insomnia it's actually one of the difficult disorders to treat, really. So we um, it's, if you do not have insomnia, but you do struggle sometimes with sleep, that then it's easier to deal with before the insomnia itself is established. General principle is that medication is not always the way for insomnia management. Um, the non-pharmacological is actually advocated. Now, we start with routine practices that we call sleep hygiene, which encourages us to have a regular time when we go to bed and when we wake up in the morning. Sometimes that regular routine is very key to train our body to sleep. Three, I mean, just two, a lot of us do our worrying during bedtime. So of course, we had a busy day. That's the time you now think about what happened in your office, what you have not achieved, and all that. So rather than doing your worrying in bed, you can allocate a time earlier in the day, during the day, that this is going to be my worrying time. It could be during your break, and then you actively make sure that that's the time you allocate for worrying rather than bedtime. Um, Drinking alcohol. Um, it's discouraged close to bedtime. I still have to have that conversation today with one of my patients who said, "Oh, doctor, when I drink, it's helped me to sleep." Yes, that's true. Initially, alcohol helps to people to fall asleep, but on the long term, consistent use of alcohol can actually make the quality of sleep to be impaired, and then you tend to um, wake up frequently during the night. Caffeinated drinks should also be avoided um, close to bedtime. I mentioned earlier about exercise, which is good. They do encourage people who struggle with sleep to exercise daily, but not so close to bedtime. Um, because if you're not active in the daytime, your body is probably will not be ready to rest at night. Then napping during the daytime is also discouraged because that takes away from night sleep and makes it difficult. So we've emphasized that your bedroom should be comfortable, and then um, avoid the habit of using your bed as an office or somewhere you do other activities. Um, so those are the basic principles. Apart from where we then go to the former um, treatment, which is like a psychological treatment for insomnia. So it is believed that people learn not to sleep unconsciously. So we can change our learning um, to sleep. Also, we can relearn to sleep. That's what it is. But it's usually very difficult because it's not going to be happen over a night. It's gonna happen over some period of time. Yeah. So I guess from tonight, if you could have a regular time, you could have certain activity you do just to like a ritual, um, maybe brushing your teeth, having a shower, reading just maybe an hour before you are ready to sleep, and then putting off the lights, making sure your room is dark and all that. Those are some of the things you could do right now. And well, without going into details about cognitive behavioral therapy, um, I guess it's spending too much time in bed is counterproductive, especially when you're struggling with insomnia. So, for example, you know that um, you normally go to bed at 10 p.m. and you are not likely to sleep until maybe 2 a.m. and then you wake up at 6 a.m. So 2 to 6 is 4 hours, but you're in bed for like 8 hours. So if you can then reduce your time in bed to like 5 hours, you still keep the time you wake up, but you don't go to bed early. Um, those are some of the details of sleep, the CBTI for insomnia. But I'm not sure we have the time to explore that further.
Thank you so much, Dr. Adeoye. I'm just going to summarize the gems that you've dropped, and I'm not going to waste any more time on sleep hygiene because, you guys can download sleep hygiene online. Dr. Adeoye has dropped some gems that are really transforming. These are things that we do for our clients that struggle with sleep, and 80% have seen improvement. A lot of them have tried sleep hygiene, and they didn't see significant improvement with sleep hygiene alone. And with some of these strategies, they see significant improvement. It does take some time, like he has rightly said, it takes about 4 to 6 weeks, but the brain actually learn it. So the first one he talked about was, connection with the bed. We have to retrain the bed to learn to connect the bed with sleep and sleep alone. So there are three things essentially that should be done in the bedroom, which is number one, sleep, number two, sex, number three, changing, if it will only take few minutes. And that's what you can start doing today. If you're not ready to sleep, you should not be in your bedroom. And he talked about that learning, how the brain can relearn. And it's a powerful experiment that has been done for several years. I went to boarding house, and I know that on the day that jollof rice is going to be served, once I hear the bell, I start salivating. Because when we talk about it, we look at it in the context of drugs. But no, it's something that happens to even human beings. I mean, I may not salivate on the day they are serving pap and beans because I really don't give a damn about pap and beans. But on the day that they're serving jollof rice, I find it really fascinating, and I start salivating before getting to the dining hall. And that's the same way we can begin to learn and reconnect the bed with sleep. Another thing that he mentioned that is really strong is, napping, that we want to avoid napping during the day. And I know that a lot of people, when they hear this thing, they say, oh, but this person naps during the day and still sleep at night. Listen, Josephine, the rules for those who are sleeping well is different from the rules for those who do not sleep well. So if you're somebody that is struggling with sleep, then you need to follow these rules to begin to see result. So you want to make sure it's something that we call sleep well, and we talk about it in details in the CBTI program. We talk about sleep well and sleep drive and how you should preserve that. But I'm just going to summarize it for you today as rise up. Once you wake up in the morning, the time you wake up in the morning is even more important than the time you go to sleep. Like he has rightly said, that you may end up sleeping for 2 hours, but you want to make sure that you are not on your bed. And when you wake up in the morning, you want to rise up so that even the little amount of time that you're spending in bed can give you quality sleep as you begin to lengthen the time of your sleep. And the third gem that he dropped was worrying, and how a lot of people worry. So he said that we should create a different time for worry aside from night. And even peradventure, because a lot of my clients say, "Oh, doctor, it's easier said than done." And when they say, "Oh, it's easier said than done," we draw a worry tree. It's like a Christmas tree. And then we look at the thought. This thought that you're having, what you're worrying about, is it an hypothetical problem or a real problem? If it is an hypothetical problem, you write it on one side. If it is a real problem, you write it on another side. Then, is there something you can do about it? The things you can do about it, you write it down. Is this something you can do right now? So you go through that list. It's called the worry tree. We run through it just to help you build better relaxation so that you can sleep better. And those are 3 things that you really can take away from today's session, aside from sleep hygiene, that if you begin to practice them, you will begin to see changes in your sleep. Adewale, you can unmute yourself and ask your question.
Okay, thank you very much. I've been meaning to ask. So thank you, doctor. So now this one is my personal problem, and as regards sleep, and I've been having this for almost more than half of my life. So currently I'm in my early 30s, and I would say I've been having sleeping problem for close to 20 years. So I've observed that I barely sleep more than 5 hours every night, and some 4. And I've been functioning well in my daytime, during the daytime, and I've not had any issue. But I know that instinctively, or at least from the little I've learned here and from the little I've learned before now, that could be a problem really going forward. Because, and again, one of my major problems is I wake up at night at least twice at the minimum. Then falling back to sleep has to be dependent on probably I'm pressing my phone or not. But sometimes, then again, no matter the time I sleep, by 7 a.m., it's as if my body clock is so programmed 7 a.m., I'm up. And if I sleep by 9, 10, by 3 or 4, I'm up. Then I won't feel the need to sleep again for the rest of the day. And it does not affect my my daily activities in any way. I work out, at least for the past 10 years, I've been working out, and still there is no major improvement for me, basically. So I don't know if you have any solution or way forward for me.
Yeah, so I mentioned earlier that the sleep need for different people differs. So there are some that are natural short sleeper and some natural long sleeper. The 8 hours is just based on the average in the population, but the most important thing is actually if there's an impairment as a result of the number of hours you're sleeping. For you, you said there's no impairment, so I won't really label you as having a sleep difficulty. And it could also be something that's in the family that maybe most people in the family don't sleep for too long or just unique to you. So I won't worry as long as you're having 5 hours of good sleep, you're able to function optimally. What you then need to do is to just regular check with your physical health and make sure things are fine. As long as things are fine, I won't worry. The
Yes.
other thing is, sorry, just you mentioned use of electronic devices in bed. I think I mean, it's good that you mentioned that because we needed to emphasize that um, the blue lights from these devices can keep us awake. So we need to avoid using our devices in bed. Um, this speaking to a lot of us really here.
Thank you. Thank you so much. Thank you, Adewale, for that question. I'm aware of two questions in the chat box, but I just wanted to reiterate that sometimes because one person says, oh, I sleep for 8 hours or 10 hours, or once I climb on my bed, I can sleep, doesn't necessarily mean that if you're sleeping for less hours, you're not on the right track. I just wanted to reiterate that. But thank you so much, Dr. Adeoye, for the question. For answering the question. So we have another question in the chat box. If we could just spend about a minute to answer the question. The first one is, what causes late insomnia? I believe we addressed the initial insomnia, maintenance of sleep in the first two questions. So this person is asking, Eunice is asking, what causes late insomnia? And then Loveth is asking, what do you do in a situation where you get home from work by 11:30 p.m., sleep between 12 and 12:30 a.m., and then you still need to wake up at 6 a.m. to prepare the kids for school? I believe she's echoing a lot of people's realities here. So, sir, if you could just, in about a minute, just give us some gems on what to do.
Well, I mean, the late insomnia usually um, a lot of times related to our mood, especially when people are depressed. So we need to find out what's going on in your mental health. But it's not always, but that's a possibility. The other question about people who are busy, whether taking care of the home or taking care of the family and struggling with their sleep. I guess that's applicable to different aspects of our lives, that we need to create a balance. So, what's important and how do we get support? Is there someone else that could? That question is always difficult to give a general answer. But I think what I would say is analyze your day and see what you could do in terms of adjustments. From what you said, it doesn't appear you have a sleep problem, but you have um, probably a stress problem related to your demands on your time and balancing that. So I guess you need to sit with someone who or analyze your day yourself and see if you need help, or maybe from your spouse or any other family member, and see how best to make some adjustment.
Right. Thank you. Thank you so much for that piece of advice. At the end of the day, with our realities as working moms, parents, even singles, whichever category we belong to, the truth is that depending on what phase of life you're in, you're probably going to have sleep varying from 2 hours and above. So it might not be 8 hours. There was something I just wanted to quickly also give as a tip in terms of cognitive behavioral therapy for insomnia, which is the gold standard. And that's seeing your body and your sleep as a vehicle. So imagine waking up in the morning, you're about to travel from, let's say, point A to point B. And if you are from Nigeria, let's say from Lagos to Ibadan, you're going to fill up your tank, right? So there's something that we need to fill up in our body. That's our sleep tank. And it keeps filling up as the day goes by. And we need to keep filling it from morning till night. And what we fill it up would be activities, especially in the first hour of the day. So things like getting up, exercising in the morning, taking a walk, or even having giving a call to a very chatty friend that can keep you awake and alive, and just building that momentum as the day goes by. And you will see that naturally you're just tired, fagged out, and you sleep at night. So that's another strategy, building your sleep tank over the day. Right. So we've obviously shared a lot of gems tonight, and I know that if there's anything that we've done, our sleep score would be improving by now. I wanted us to do like a sleep scoring initially, but we were not able to do that because there's a lot to talk about in an hour. But we'll be concluding soon, and I'll be handing over to my co-founder, Adebusola, just to wrap up the points and give us further information. Thank you, Dr. Adeoye.
Thank you so much, Dr. Adeoye, and thank you, Omoti. It's our hope that today we've learned a few things that if we really start implementing, we'll begin to see changes in our sleep if we struggle with sleep. One of the reasons why we wanted to do this webinar was because we know that a lot of people struggle with their sleep, and these are people that we see regularly on a day-to-day basis. But if you still want some personalized answers, some personalized approach, or you want to try CBTI, especially if you're on sleep medications, you want to wean off sleep medication, or you're struggling, then you can send us an email, because we are doing a 6-week workshop that would use all the skills of CBTI that a lot of people find benefit from. It helps at least 80% of people struggling with sleep. So if that's something that you want to consider moving forward, you can definitely send us an email and we'll see how to work with you to better improve your sleep. If you have any more questions about sleep, you have our emails. If you register, you can send us an email, and we'll be having our next session on the 6th of June. So we'll send details via email. Thank you, everybody, for joining. Thank you, everybody, for joining today. It was such a pleasure. And we appreciate you greatly, Dr. Adeoye, for joining us and for being there. Thank you, everybody. Have an amazing night's rest. Make sure you're not on your bed until you are ready to sleep. Bye-bye.
Exactly. Bye.